My name is Jeff Watkins. I'm the podiatrist here at Castle Orthopedics. So what really led me toward podiatry was probably a conversation that I had with my grandma's podiatrist. He had a strong sports medicine practice, and then I got to thinking about that, and then the overall practice of doing palliative care, conservative care, obviously surgical procedures, and seeing everybody from young kids to elderly probably led me more toward that podiatry aspect of it. To try to help patients understand the complexity of their problem, first you have to gain their trust so that they're going to understand what you're saying to them. It's hard to tell people sometimes that their heel pain may actually be caused by something in the ball of their foot, but you have to sit down and sometimes take a model out and draw it out for them so that they can understand it in an easier fashion. So one of the biggest problems I see that are underdiagnosed or misdiagnosed possibly are soft tissue injuries that may lead to, say, a hammer toe, where people think if I just fix the hammer toe I'm going to be okay, when in reality you need to really fix the soft tissue or the trauma that occurred so that you get a good ending result. Having rehabilitation on site is almost invaluable because you can literally walk over to them and ask a question about, hey, I have a patient who's having this problem. What do you think about if I order some e-stimulation or some dry needling or things of that nature? And then even if I just simply want to give patients a home exercise program, I can walk over to them, they'll print out the information, and I can give it to the patient right at my visit so they can at least get that started before we do formal therapy. My greatest reward from podiatry, I would say, is the fact that I practice in the area that I grew up. And when we see patients either at an event or even at the grocery store, and I'm able to introduce them to my wife and my family, and they're happy with the result that they had, and they tell my kids that. And that's not something you would get if you don't live in the community that you practice in.